Hello, this is the Integral Dose podcast. My name is Vale.
And my name is Sarah.
And my name is Sarah.
Another day, another dose.
This is the podcast that covers all things related to integral to radiation therapy.
Hey, I'm gonna pause you right here. This is Atika, your editor for this episode. So this one is special as it is our first time covering and recording at a live event. The audio quality for this episode may not be as great as our usual standard, but you know what? That's okay. That's the beauty as we capture the liveliness at the event itself. Occasionally, you might also hear my voice providing small commentaries throughout the episode to give you a better idea of the context of the conversation. We hope you enjoyed this one and happy belated Allied Health and Pharmacy Day.
Our cluster celebrates Allied Health and Pharmacy Day in the month of October. So in our institution, National Cancer Centre Singapore, we are celebrating it today.
NCCS is a specialist centre and is home to at least 7 major allied health and pharmacy groups, along with several allied health support staff. We have radiation therapists, us, dosimetrists, diagnostic radiographers, genetic counsellors, medical social workers, physicists and pharmacists working together in this building to provide allied care for our patients.
In total, there's about 350 of us. That's a lot.
Yeah, today we hope to reach out to some of our fellow AHPs live at the event to ask them a few questions about their career.
I'm so excited to be here. There's so much energy in this room. Like, there's all the booths that we can learn about. There is a whole lot happening in this room right now. Look at all the allied health and the pharmacists that are here. So over here we have the medical physicist booth, we have psychosocial oncology, and we have radiation oncology that is here. That is us. We represent radiation oncology. And we also have the pharmacy booth right over here. It's so lively. There are so many professions right here. It's a lot to learn and see and do as well. There are a lot of games, challenges, and prizes to be won. So we are very happy to be here covering this event. So the Allied Health group is really like, I feel personally that it's like a bit overshadowed by like the medical profession and the nurses. Yeah, so it's a great time for us to spotlight the Allied Health profession. So we get to learn more about what people do. Tell me a bit more about what you are doing now.
I'm helping to set up the price. So he's the main in charge. He's trying to pinpoint where to put the target and the OAR.
I see that. So there is actually an outline, a silhouette of a body on the table, and there's like bowling pins and there's target blocks lined out, and the participants will actually be given like Nerf guns to actually shoot down the targets while avoiding the organs at risk.
Yes.
So I think that's a very cool concept.
Yes.
Yeah, I can't wait to play when it's all ready later.
Alright, so in this next conversation, their voices might be unfamiliar to you, and the reason is because our hosts were very nervous, excited, and just kind of feeling it all and jumped straight into the interview without any of the introductions. I'm just gonna give you a little introduction about them. First lady is Tasha. She's a radiation therapist. She's also one of the organizers of this event together with myself and a few other representatives from the different allied health groups in NCC. While we were getting ready for the event, they bumped into the main star, the person who brought this idea of organizing an allied health and pharmacy day in NCC. And it's not just any day, it's the first time we're organizing this. She's none other than Prof. Lita Chew. Prof. Lita Chew is Group Chief Pharmacist at SingHealth and also the Director for Allied Health and Pharmacy in NCC. With her guidance and her vision and the support of the department leads from the respective allied health groups, we were able to bring together not just the event but the many allied health and pharmacy professionals together on that day. Let's jump back into the interview.
Yes, so my colleagues Bill and Sarah. Hello. They have a RT based, but this for this episode we're doing an AHP special. So can you interview for a few minutes?
Sure.
Yeah, yes, we'd love to hear what you have to say. How do you feel like being here part of this amazing event?
Amazing. That's the word,
Yeah,
right?
it
And
is.
I really think that, we have a great team for putting this together,
Yeah.
right? And I really look forward for more people to come down and enjoy and have fun. I think let's head down today. Okay, Ken?
Yeah, great,
What are
great.
your hopes for the AHP, NCCS, AHP and pharmacy community in the next year?
The community, right? My only wish is for them, okay, I know that they're all doing a very good job, for them to look after themselves. Because only when they look after themselves, they can help us to look after our patient.
Yes, indeed. Mental health, mental well-being,
Yes,
psychosocial
yes.
support. Yeah,
Take some time to care for yourself.
exactly.
Okay? Yeah. That's my wish for everybody, okay? To look after yourself so that you can help us look after others.
Very
Thank
well
you.
said. All right.
Thank you.
Thank you so much.
So hi, I'm Ivan. I'm with the Department of Psychosocial Oncology. I'm a social worker. Just one message for my fellow allied health professionals and pharmacists. I think we can play a major role in creating a sustainable healthcare ecosystem and social care ecosystem for Singapore.
Definitely, yes. Like medical social work, it requires so much, like more than just it seems on the surface. Yeah.
Yes, it does. Yeah.
How do you feel like seeing all the other like allied health professions being featured here today?
Oh, I'm very encouraged. I mean, this helps each allied health professional get to know each other, and actually it helps build up the team spirit. I think moving forward, now the allied health profession can be working in silos. We have to work together to create that sustainable environment that I talked about earlier on.
Yeah, it's very collaborative. Yeah. Okay, that's great. Thank you
Okay,
so
thank
much.
you so
Please
much.
enjoy
Thank
your
you.
ice cream. Would you like we have a token of appreciation here for you.
Okay.
This is like some sort of a fidget toy. Can you tell me a bit more about yourself first?
Oh, okay. Okay, I'm Ziyong. I'm the executive and I'm the one that's planning this event. So
Great.
I'm quite happy with the results that we have because it was quite stressful the last few days when we were planning and trying to get people to like do out the menu and all those. But overall, I think it's quite a success so far.
Yeah, it looks great. Like everything is coming together. The balloon arches, the free food. Oh, it's amazing.
Yeah, so that's what I wish for everyone to enjoy as well. So as long as everyone is having fun, I think that's the best for me. Yeah, that's a success for me.
How do you feel like getting together all the groups of allied health, like professionals, to like come together to like spread awareness and all this?
Okay. I feel like I'm accomplishing something because it seems like not everyone know everyone, even though we are AHP and even people from the same department, maybe they are a very big department, so they don't even know each other or haven't met each other. So like giving them an opportunity to like sit together and have fun, play games. I think it'll be great to have more bond and it'll be more cohesive in future when we do work together.
Yes,
so
indeed. Very well said. All right, great. Okay, thank you so much for your time.
You wanna introduce yourself?
Yeah.
My name is Gerard. I'm a medical social worker from Department of Psychosocial Oncology.
All right.
And
My name is Sherwin, associate psychologist at DPO.
All right. Can you tell me more about what you do and like what your day-to-day work life is like? Yeah.
we are similar yet different in some ways. So for myself, I see patients with psychosocial issues, and which will range from like intra-emotional kind of issues that brought about by the cancer lah. And also we also provide like financial assistance.
Must be a very challenging job. Like it is definitely a very big change for the patients who are undergoing like recent diagnosis, right? Okay. How does it feel to be part of this event? Like seeing all the allied health professions come together, share a bit more about themselves, learning more.
I'm quite surprised there are so many different kinds of professions, all with one aim of helping the patient. It's quite hard for me to know that also.
Have you played any of the activities, the games?
Not yet. I just started.
All right. Yeah, you have fun playing all the activities later. All right. Thank you so much for your time.
Oh, so what is your profession?
Radiographer.
Radiographer.
Yeah.
Okay, so how long have you been in the radiography line?
In Singapore. In Singapore, 1.5 years.
1.5 years.
Yeah.
Okay. So what do you like about your profession?
Mostly it's like helping the patients to like, especially in imaging, very imaging. So we're helping the patients and the doctors also to like properly diagnose.
All right. So describe in 3 words about your profession.
3 words: interesting. What else? Interesting. Interesting.
Interesting.
Yeah. I think that's all. Yeah. 3 words: interesting.
So, okay, the last question. What advice do you give to your future radiographers if they want to be in this profession? Yeah, just one advice.
Follow your goals.
Okay, right. Okay, that's great. Thank you so much.
Here we have Vivian. She's a radiation therapist. She's actually one of our colleagues So Vivian, today, how do you feel about the event here? Like seeing all the AHPs coming together. What are your thoughts, feelings?
It's really fun. There's this very cute keycap that lights up and it's a linac on it. So I love it. Yeah.
I've been eyeing on it.
Yeah. I came here for it.
Do you have any words of encouragement for future radiation therapists or anyone who wants to join AHP?
I think it's a fun job, especially because you get to rotate between different departments. So it's a lot of variety. But if you want to open your own practice in the future, then maybe that's not for you because you can't afford the machine anymore.
That's true. Maybe do something else. Yeah. Do you have any other interesting facts to share with the public about, do you think radiation therapy should be seen more or publicized a bit more with the public? Because I don't think a lot of people know about us.
I think for sure, because most people, when you talk about cancer, right, they just think about like chemotherapy and all that, but they don't really know what to expect when they come here as well. So it'll be great if we can create more like public awareness for them. So I think things like the podcast is really good for them as well.
Alright, that's great. Yeah. Thank you so much for your participation.
Hello, my name is Priscilla. I'm currently a student studying radiotherapy. I'm from Monash University in Melbourne and I'm on my second year of Masters. So I'm a final year student.
How do you find your attachment so far?
So I've been here for 2 weeks and so far it's been really interesting. The healthcare system is very different compared to Australia and Singapore. But overall, I've really enjoyed it. Everyone's really nice and I've learned so many things. It's been overwhelming but in a good way. So I've enjoyed it so far.
What's the difference between healthcare in Australia and then in Singapore here?
That's a good question. I would say cultural difference is such a big
culture.
Yeah, because I went to when I was in Australia, I went to a rural part of Australia. So the demographic is mainly a lot of Caucasian people who have a lot of sun exposure.
So skin cancer lah.
Yeah, a lot of skin cancer and a lot of other different ones. So I would say culture is a very big difference. Even though I'm Singaporean, I would say like I never really got to learn about the different cultures here. So I think it's been very interesting to learn in terms of people's different backgrounds. So that's a really big difference, which I think shapes like patient care very differently. Yeah, that's something I found really interesting and just meeting so many different people. So it's been so good. Yeah, I really like it. Yeah.
Thank you so much, Priscilla.
No, thank you so much. I enjoyed. Thank you.
I'm a research coordinator.
Research coordinator, okay.
In medical college, yeah.
So what do you exactly do as a research coordinator?
So we will consent patient for study. So basically, we are under lymphoma and sarcoma. So we will consent patient, collect samples like blood, tissue samples, do some clinical trial.
Okay.
Yeah.
Is it very hard to get patients to consent?
Depends.
Okay. So what is the one thing that you like about your profession?
If we send the patient for like example clinical trial like impact study, once they went through like some trial and then they got better, like they become stabilized, then we feel very fulfilling. Yeah, but then when they go to PD stage, then we feel very demoralizing because it's not suitable for them. Yeah,
I see. Okay, so last question. What is one advice you would give to future research coordinators?
It's okay to get rejected.
It's okay to get rejected. Okay. That's great. Thank you so much for participating. Alright, okay. So the first thing I would ask is, what is your profession?
We are genetic counselors.
Okay, so introduce yourself.
Okay, I am Manasa, I'm a genetic counselor.
I'm Shouts. I'm also one of the genetic counselors who work at NCC.
I'm Diana. I'm also a genetic counselor. So we represent the Singapore population of a different ethnic group, Indian, Chinese, Malay.
Yes. I heard from Miss Lee is that there's only 30 of you in Singapore. In Singapore, right?
Yes.
Yeah, okay, that's very, very, very niche. So what is it exactly that you do in your profession?
So we are basically a professionally trained allied health professional. We train in both genetics as well as counseling. So we offer patient genetic testing to help them understand what is the underlying genetic cause for their disease. And during the consultation, we will also offer them the risk assessment as well as, to tell them, explain to them what's the pros and cons about going through genetic testing. At the end of the journey, we will also help them interpret their genetic result and what's the possible implication for them.
So which is the most, the most popular site for like genetic counseling? Is it breast, prostate, or mostly breast?
All organs, about 5 to 10% of all cancers
I
in general.
see.
Our patients mostly, if we were to say what cancers we see most often, are breast, ovarian, and
Yes.
colorectal that we see mostly.
I see.
Because that just is the most common cancers as well in Singapore.
Because from what I know, breast cancer they usually are quite genetically.
Yes, it can be hereditary based on
Yes,
family
yes.
history. Yes.
Interesting.
So maybe I add a bit. So actually, different cancer has different proportion that could have a genetic, causes.
I see.
Yeah, breast is about I would say 10 to 15%.
10 to 15%.
Yeah, but we
okay.
actually see a lot of different cancer types. So it really depends on what's the cancer type. The proportion will be a bit different.
I see. Okay, that's good. Very interesting.
Maybe can you share about how does one become a genetic counselor? What are the steps or routes needed to take to get there?
Okay, so the minimum required is a master's degree in genetic counseling, which is available all over the world. Typically, anyone from a life science background or biology background can go ahead, who have a special interest in genetics, can do a master's program. And once you have done a master's training in genetic counseling, you're eligible to be a genetic counselor.
Wow, actually that's a really long and long route, yeah.
Only 2 years.
Wow, that's actually a really long route, right? Right. I think a lot of people like when you hear genetic counseling, oh, that's so interesting, but no one actually knows how to get there. Yeah, it's so niche as well.
Yeah.
So this will definitely help people who are keen in knowing. Yeah.
Yeah.
All right.
So what is one thing that you will advise for future genetic counselors?
Well, I think keep an open mind and keep a very keen mindset that you will always be wanting to learn. I think that's most important.
Correct.
And every case that you see will be a learning point and will give you a good experience and also a fulfilling position. I think this job is very fulfilling.
Yeah, rewarding job.
Is it rewarding? Can you explain more? Because I mean, you see the patient.
Yeah.
And then how is it that you feel that it's
I think
rewarding?
it's about giving our patients a closure, but also an answer as to
I
what's
see.
been happening with
that's
their
important.
family.
Correct.
Regardless of the results. Like we try to frame it in a positive way and kind of give patients an answer to what's been happening and guide them along the journey, and to see them navigate the journey and be along with them through that journey is rewarding in itself. And being a part of their care, making sure they're well taken care of, not just them, but also the entire family, because genetics, you have risks for the family members as well. So that part of it is quite rewarding.
I think sometimes we focus a lot on the patient, but we don't really think about the family members. And I think that really helps them to, give them some sort of closure for their journey.
Thank you so much.
That was so insightful. Thank you.
Okay, we have Zubin here, medical physicist.
Hello.
Hi. Okay. So Zubin, can you describe what is your profession?
So, a medical physicist works in radiation oncology or any department that produces radiation, and their job is to make sure that the radiation is controlled properly and used safely, and patients don't get hurt or harmed.
Correct. Okay. So how long have you been in this profession, Zubin?
About 20 years.
Wow. We have a maturity. Okay, 20 years is a long time. So what do you like about the profession?
I like the fact that I work with patients, and what I do has meaning and has some value in society, I guess.
All right. Describe in 3 words about your profession.
Okay, so 3 words. I would say we do risk management.
Okay.
We do science.
Okay.
And patient care.
All right. Awesome. So to become a medical physicist, what kind of qualifications? Yes.
Usually you start with some background in physics, so a bachelor's in physics, and then you do a master's in something around biomedical engineering, medical physics, around
How
that.
about those PhD candidates in physics? Is that like a optional career path?
It is. It's becoming more and more common now.
Yeah, I see that. Okay. All right. Okay. That's all.
Okay, hi. So with us, we have 2 pharmacy technicians. Can you introduce yourselves?
Hi, I'm Rafika. Hi, I'm Pika.
Okay.
Pika.
Okay. You all sound very similar. Okay. Okay. So how long have you been like a pharmacy tech, or like what do you actually do?
I've been working here for like 3 years.
3 years. Okay.
Yeah. So Usually do a lot of like processing of prescriptions for the patients and interacting with the patients. Yeah.
The patients, okay.
I've worked here for like 2 years. Yeah.
For 2 years?
Then normally, I think in the pharmacy we just do like registration, dispensing, packing medication, take the orders. Yeah.
Things like that. I mean, like all patients actually go to the pharmacy to collect something, right? So it must be quite a physically and mentally challenging job.
Yeah.
Because it's very draining and like, how many patients do you see a day?
Oh my god, this is like 300 plus a day.
Wow, it's like so busy,
it
right?
Like increased. Previously was only like hundreds over, then it like shot up to like 200 over patients.
Wow, so it's like non-stop action, right?
Yeah, the back end, they're the back end's heroes. I think they're the one who sorts. Are you the one that sorts the medications?
It depends because some days we are outside also, so we do registration. Then PTs also dispense, so we'll be inside and outside as well lah.
I see.
But most of the time the pharmacists will be outside, so we kind of support them. Yeah.
Okay. As a pharmacist technician, name 2 drugs that sound similar. Wow. But have you ever mixed up 2 drugs? Or if let's say, correct.
Look alike is
Look
look alike a lot.
Oh, so how do you distinguish the
We
drugs?
usually have, because now we have a machine, right? So usually the machine will spit out the correct drugs. Unless it's at a manual zone, then we have to be careful.
We have to be careful.
So for dispensing, actually also we have the system where they can show you the photo of the drug. So that we don't have to go inside and actually like check the tablets, what it looks like. Because when we're outside, we need to check correct drug and all that. So like the system will actually can show us a photo like if it's inside.
Interesting.
So I always thought that like dispensing medication is very manual, but you guys have a machine that does it, is it?
Not really machine, but a system.
A system that just counter checks, is it?
Yeah.
Oh, wow, that's so interesting, right? I think without that it will be even more laborious.
Because
without
now
double
like
checking.
it's super fast paced, so we need everything to be like fast,
right?
But then cannot be fast without being accurate. So it's like
correct.
now we depend on the machine to like help us be accurate. Yeah.
Just like us, accurate and fast.
Accurate and fast and efficient, yeah.
Okay, thank you so much.
Thank you so much. Thank you so much.
Alright, okay, so we have Puchi here, who is a dosimetrist.
Hello.
Hello, hi. Okay, Puchi, so dosimetrist, what exactly is your profession? What do you do? And
Oh, okay. For us, we just design the radiation beams. So basically, make the treatment beams like shooting at the target. At the same time, you will help to reduce the dose to the normal tissue. Try to protect the surrounding normal tissue.
normal tissues.
Yeah, so that's our job.
How long have you been in this profession?
Wow, I joined in year 2000.
2025
Yeah, you do the math.
Let's see where Zubi around there, huh?
Zubi?
Longer than Zubi, yeah, correct. So, 25 years, that's very, very long. I know that you teach too, right? Do you teach students? Do you still do that?
Now let the younger one to take up the teaching,
Okay, that's good. So, what is the most fulfilling or satisfying aspect about your job?
Okay, so basically once we finish the plan, we look at the dose coverage is very perfect to the tumor, and then at the same time we are able to spare the normal tissue. And then at times when a doctor come give us a feedback, say, see, this treatment responded so well. That's how we feel, because usually we are just at the back end, we don't see the patient.
That's
so
right.
it's more like when we get feedback from the therapists, from the doctors, then we know how is the the progress, the outcome. Then sometimes it's really encouraging. Like tumor responded very well.
That's right. I can understand because we are in radiation therapy, so we understand what exactly this fulfillment is lah. Okay. Yes. Okay. So alright. So describe in 3 words about your profession. 3 words.
3 words. Can you give an example? Like what type of?
Maybe like words. For example, you are a dosimetrist, so you need to be accurate.
Oh yeah.
Like that sort of
Okay.
So 3 words.
Yeah, accurate and also sparing.
Okay.
And also coverage.
Alright. That's good. Thank you so much, Ruchi.
Okay, thank you so much.
Okay, so today we have Lois with us. Lois, do you want to introduce more about yourself?
Hi, I'm actually a medical dosimetrist working in DRO. So
Okay.
I do treatment planning for cancer patients.
Okay, what is the most challenging aspect you think about your job?
Challenging aspect, deadlines.
Deadlines.
Yeah, deadlines. Yeah.
Can you elaborate more about the deadlines? Like, how long are you usually expected to finish like a plan or meet a certain deadline? Is there like a range for it?
Yeah, there's always a CT date and a treatment start date. So in between where we have to do our treatment planning, so the doctors will have to draw the target volume, and then another doctor will draw the organ at risk, and then we'll start planning. So generally we only have like 2 or 3 days to plan depending on the complexity of the plans. Yeah, 2 or 3 days before the treatment start date, our plan has to be ready because the physicists, the doctors will have to approve the plan, physicists have to do QA check, and our internal people have to do a second check. And on top of that, the machine will have to do a QA first check, second check. So the deadline is very tight. Yeah.
Wow, that's a lot of steps before the patient actually gets to be treated, right?
Yes.
Right. I'm sure like people have heard about medical dosimetries, but how does one actually get to reach the stage of being one? Like what are the steps needed to
Okay, generally most of us actually started as a radiation therapist. Yeah, so currently they only allow senior radiation therapists to join, to be advanced planner. Yeah, so generally you need to have ideally a degree in radiotherapy, and then you proceed to do advanced planning. First you have to start with a basic training course first for 6 months. And after that, if you're interested, you can join us as a full dosimetrist. And from there, we'll train you for a year or so. Once you pass your so-called internship, then you'll be able to do higher end of treatment planning. Yeah, so that's how the path is currently. Yeah.
I see. Wow. That's
I just have one question. Basically, we have photon treatment planning and also a proton treatment planning. So for proton wise, the treatment planning, you only allow like senior dosimetries to plan on it. Advanced or beginner one will stick to photon treatment planning. How does it go about?
Okay. Yes, you're right. So proton planning started is because under the MOH regulations, you need to have certain certifications.
Oh, that's why.
That's why you have to, like when we first started, we actually had to attend some proton conference, this PSI workshop and all that. And then after that, we will have 4 months of internal training. And at the same time, we will have to go to various proton center overseas for attachment. Some is between 1 month, 3 months to 6 months. Yeah. And then with this credentialing, then we can do all the proton planning. Yeah.
Wonder.
Correct.
So
Yes.
it takes a lot of experience to be a proton dosimetrist.
Yes.
Technically, right?
Technically, because first of all, you need to know all the basics of treatment planning.
Correct.
So generally, like the advanced planner, they started with like VS, 3D, then ZMAX.
Yes.
So maybe after a few years, then they can do the proton planning. So currently, we do have a few, I think 2 or 3, who actually, because of us, all of us are already credentialed already, so we are putting them into training to do proton planning.
Okay,
So far, I think we have 2 who actually do the proton planning. But
Alright.
of course, I think they still have to attend some proton workshop,
I see.
something like that. Yeah. So advanced planner in future will have a chance to plan because ideally we want everybody at the end of that to be able to
accredited
plan
lah.
everything.
Yes.
Yeah. So it's a matter of time only.
Okay.
Yeah.
Thank you so much, Lois.
So if you are thinking of becoming a medical dosimetrist in the future, probably you can take some of this advice and see how it goes. Yeah. Thank you so much, Lois. Thank you very much. Thank you very much.
Okay, hello. Hi, we have a radiation therapist here. Do you want to introduce yourself more?
Hi, my name is Hong Lip. I'm a radiation therapist working in DRO for 9 years already. Yeah.
Wow, 9 years already.
Yes, correct.
Okay, so what do you like about your profession?
The feeling that I am doing something good every day, seeing my patient come here and being part of their journey towards the treating their cancer. Yeah.
Okay. In this profession, have you ever encountered any challenges?
Challenges have they come in many forms. I mean, sometimes patient during their treatment, in terms of treatment delivery, we may encounter some issues that we need to learn how to troubleshoot all these. And then also sometimes patients themselves, when they feedback to us, say they are not coping well with their treatment, all this, then sometimes you will feel sad. I mean, when you hear that that they are not doing well, they feel uncomfortable, and then I mean we try our best to help them, but at the same time we also feel very sad that you hear things like this.
Alright. In your line of work as a radiation therapist for 9 years, have you encountered any moments that is memorable for you? Yeah.
Actually, I feel that every day, I mean, for most days, I have encountered a lot of good things, memorable things. I mean, sometimes when we see the patient coming for treatment, after a few sessions, you can see some of them, they are responding well to treatment. Then you feel good. I mean, they finally, I'm doing something for them.
Yeah.
Then it's working for them. Yeah. Then I will feel happy for them.
Feel satisfied
correct.
them.
Yes.
Okay, that's good. So, any advice for the future radiation therapists out there if they want to join RT in the future?
Our department, our patients at the heart of what we do. I mean, yeah.
Alright, okay, thank you.
Thank you.
Truly embodying the Sing Health mission, vision, core value. Thank you so much, Lee.
Alright, can you just introduce yourself and what do you do and how long have you been in the profession?
I'm Shafika. I'm a radiation therapist. I just turned 4 years old in NCC. PRO.
The baby.
We are both babies.
We are batchmates.
Yeah, so the question for you, qualities do you think would make someone well suited to be in a allied health profession, as like for yourself, radiation therapist What qualities should they embody?
What qualities?
Yeah.
I guess a bit typical, but empathy. Because empathy.
Okay.
Because I feel like you should be able to, be in the shoes of your patient, understand what they are going through, not just the patient. But then also their family members.
Yes.
So you have to understand your patient as well as their family members. Sometimes the patient okay, but then the family members a bit kanchong for their own relative, right? Yeah. So you have to be able to be in everybody's shoes actually.
Correct.
Understand everyone.
Well said. Next question. So in your opinion, what could be done to raise more awareness about allied health professions in general?
Because we see a lot of maybe promotional material about nurses, join doctors, but the only ones we see is bright sparks, or MOH.
So patients only understand the surface, they only know doctors and nurses exist, so they don't understand that there are us.
They just call us as nurses because they don't really know.
I've been called a nurse too.
Yeah.
I guess we ourselves can approach maybe schools, or we can make our own organization or something like that. Because I've been in the Muslim healthcare outreach program. I gave a talk about radiation therapy to JC students, if I'm not wrong, and also secondary school students. So from there, they knew that there are other allied healthcare professionals also. So I guess that was a really good platform for them to know that there are other choices other than doctors and nurses. Yeah, so I feel like, I don't know if there are other groups that do these kind of talks for the youths, but I felt like that was one of the good initiatives. Yeah.
So how do you know about radiation therapy then?
Oh, because I went for the open house. SIT
open houses.
Yeah.
Okay, that could be wide lah. Thank you, Shaf. You're welcome. Hi, Naf. Hello. Okay, Nafia is also a radiation therapist. Any reflections about your profession as a radiation therapist? Yeah, can you introduce yourself first?
Hi, my name is Nafia. I am a radiation therapist. Well, I've been coming to 5 years already.
5 years.
So reflection, I would say it's going to be a summation of these 5 years, I guess. So I guess when we started off, we
were babies.
We were babies, it's true. Now I think we've morphed into a junior RTs and slowly moving, progressing forward, I guess. So I think I truly see how this allied health impacts our patients. Yeah. I think that's the most rewarding thing that keeps us going. And I would say, reflecting back, I feel I made a good choice. Yeah.
Oh, that's great. Is there any moment or any memories you have as a radiation therapist that is very fond for you?
Okay, I see. Okay. I can't say one specific memory, but I would say the moments in which I feel most appreciated as a allied health is when patients tell us you made my day, or Like I feel so much calmer now, or so
that's nice.
so much more confident to come for the treatment.
Yeah.
I guess giving them the support that they need.
Yeah.
I think what Nav said is really very true. I think most of the times, because we operate machinery to treat patients, right? But the thing is that anyone can be a button pusher, right? It's really about bringing the patient through the journey, taking care of their emotional well-being as well.
That's true.
And I think like what Nav said, sometimes patients come to us so filled with anxiety and they are so scared of the treatment. But
True enough, yeah.
I think they really hold a lot of hope in us to comfort and reassure them. And
That's true. Yeah. As a therapist, I think we really do the part to comfort them more.
it's the human touch, right?
Yeah, it's true. Yeah.
Thank you so much for sharing.
No
It's
worries,
so
thank
inspiring.
you.
Yeah.
Happy Allied Health Day.
Happy and I have the
Hey, it's me again. You're at the 35-minute mark of this episode, and you must be wondering why we just had 3 radiation therapies back to back on the interview. Fun fact, in Singapore, radiation therapists is not the biggest allied health group, but at NCCS, we are the biggest group amongst the different allied health groups. And the reason is because our profession is rather niche and can only be found in specific specialist centers. Interesting, right? Okay, now back to the episode.
Hi, Olivia. We have a pharmacist here. So, Olivia, you can just briefly introduce yourself, what you do.
Okay, I'm a pharmacist. Been in this line for 20 plus years.
Okay, 20 plus years. So, as a pharmacist, what exactly do you do? We just interviewed a pharmacist technician. Are they different from you?
We work on the same things to provide safe medicine to patients, to the right patient, the right drug, the right dose at the right time.
I see. Okay. So, what is one of the most challenging thing about your job as a pharmacist?
You have to always be alert, be careful so that you don't make any mistakes.
Yes, because making a mistake could be grave enough, right?
Yes.
You understand that?
Do you also play a part in like decision making, or maybe sometimes like if are there cases whereby like a doctor dispenses something and then you saw the prescription and just like, hey, this combination doesn't seem really right.
Yeah.
Interesting.
Can you briefly describe like a scenario?
If we see something, anything that looks like it could possibly be an error or possibly be overlooked, then we will do our due diligence to double check. Half the time it's not an error, but we still need to be careful just to ensure that something is not overlooked.
So they're actually like one of the main gatekeepers of medication dispensing, right? So in 3 words, what would you describe your job to be?
Careful, meticulous, and accurate.
Yeah. All right. Okay. To be a pharmacist, what do you have to go through? As in the qualifications.
You need to do a degree in pharmacy and then pass a competency exam, pre-registration training, which is a year, and then you need to pass your law exam, and then every 2 years you have to complete your continuing education points in order to keep your registration.
Oh wow! So many steps to become a pharmacist.
Yeah, and every 2 years you have competency, right? So redo every 2 years.
2 years.
2 years.
Continuing education points.
Oh
wow, that's such a long route. Anything to say to future pharmacists? Any juniors aspiring to be one?
You have to work hard.
Work hard and pass your exams, guys. Okay, we have to study hard now. Thank you so much. Okay, so here we have Damien. He's a pharmacy intern. Damien, you want to introduce yourself to us?
Yes, I'm Damien and I'm currently a pharmacy intern.
Okay, so Damien, how long have you been here at NCC?
Actually, just for nearly 1 month.
Nearly 1 month.
Yes.
So how is it so far? You describe your experience. Is pharmacy, is the internship what you expected?
Yes, actually I learned more than I expected over here. So I've been to different labs and like helping out with different tasks. Yes, so it's been great.
Okay. Applying your knowledge from classroom to hands-on, is it very different, or like what are the challenges have you faced so far as an intern?
Okay, so probably for me, right, in school we learn about different drugs and all the drug interactions and all that. But in this profession, I think currently as an intern, I'm doing more of the more specific tasks. Like for example, packing and restocking all the different diluents and all that. And sometimes because I don't learn very in-depth into the different products out there, so sometimes I might get confused a little and like make some mistakes. But through the process, I'm still learning, and yeah, very great experience.
I mean, like making mistakes is part and parcel of learning, right? If you don't make it, sometimes you don't really know what you don't know yet, right?
Yes,
correct.
Absolutely.
What advice would you give to, maybe your junior pharmacist to be like preparing for their intern in a center? Any advice that you will give them?
I think it's just to like keep an open mind because like you might not get the job that you think you are going to get, and then you're definitely gonna learn something. So yeah, just keep an open mind and try things out.
Try things out. Okay,
Yes.
that's amazing. That's amazing. Any other tips and tricks you would like to share with anyone, or
Sleep early, get enough sleep.
get enough sleep, guys? You know, procrastinating is real. Sometimes you feel like after working for a long day, you don't really have much time to yourself, so you end up sleeping very late. So I think, yeah, sleep early, guys. So
Thank you.
thank you for your internship, man.
Thank you.
Thank you so much for being on the podcast.
Hi, would you like to introduce yourself, like your name and what is your profession?
Hi, I'm Jeannie and I'm a radiation therapist.
All right, and how long have you been in this
I'm in
profession?
this line for 10 plus years.
Plus,
You know,
say that
it's like age like that, better don't say lah.
Okay, and what do you like about being a radiation therapist so far?
I like being around fanciful machines and of course wonderful colleagues.
Oh, wonderful colleague is very important.
Exactly.
Because if your colleague's not wonderful, then it's hard to come to work every day.
Mental health is very important.
Jeannie, you are an advanced practice radiation therapist, right? What do you specialize in? Can you tell us a bit more about your role?
I specialize in gynae.
What do you do as an advanced practitioner in gynecological cancer?
So usually we help patients as in detail. That means we go through, follow the patient flow all the way from consult, CT, then treatment. And then I do like image approval for their treatment. And then I also track them for toxicity, weekly toxicity. Yes. So
Basically,
this is...
like you follow them from start to end, actually.
Correct.
Do you actually see them after treatment also?
For some cases, if I happen to be available, so sometimes I do follow doctors to the clinic. So if I'm fortunate enough, I probably can see them probably 1 month after the external beam or the whole radiation. But most of the time, I don't really see them.
All right, thank you. And if you have any advice to anyone who would like to be an advanced practitioner, what would be the advice?
Number one, I think you must really like clinical work because there's a lot of patient contact. And you must really like your profession in the very first place.
Yeah.
So if you don't like, then I don't think you are cut for it. And of course, you need to study hard. It's not a choice, it's a criteria. Yeah, you need to do a lot of study.
Yeah.
Mm.
All right, thank you, Jeannie.
Thank you.
Thank you, Jeannie.
Okay, hi. So today we have with us two pharmacy interns. So I'm gonna ask a few questions to them lah. How is your internship so far here? Are you interning at National Cancer Center?
Yeah. Yes.
How do you find it so far?
Very fun, very interesting.
Very interesting.
Educational.
Educational. Has it been what you imagined it to be?
Not really, because I never learned cancer drugs before. We usually learn about the general medicines. Yeah, so a bit slightly different from what I imagined.
A bit different lah. How is it translating like what you learn in class, like theory wise, to something hands on? Is it challenging or comes quite naturally to you?
I won't say it's challenging because the staff here are very friendly to guide me around, and then they'll just give me very clear instruction on what I have to do. So it's still okay lah.
Still okay lah.
Yeah.
So far, how long have you been interning here?
4 weeks.
4 weeks. Like you yourself as well?
I'm a temporary staff.
Okay, temp staff here. Oh, okay, can. Temp staff in which
oncology pharmacy.
Pharmacy. So you're also a pharmacy technician. Okay, so what is the difference between a pharmacy and pharmacy technician?
Pharmacist is like more like they will check the dosage, everything with the doctor.
Yes.
Then whatever the doctor prescribed, they will check. And then for us, we have to recheck again before we could dispense to the patient.
I see.
But then if you are a senior pharmacy technician, you can dispense also.
Okay, so in the autonomy goes up as you with experience lah.
And then for oncology pharmacies, we more likely we have oral drugs and we have IV drugs also. So the IV drugs will be make in a clean room.
So you guys will be the ones titrating it?
Yeah, there is pharmacy technician who can make it, but we more likely outside of the lab helping them.
I see. So are those making titrating the drugs for IV? Are they more of specially trained or?
They just have the course.
Or they have to take a course to do that lah.
Yeah.
I see. So actually there's a lot of categories categorization.
Yes. And if you're a full time, you get to go in lab also.
So it's like a specialization. Oh, that's so interesting. I think I never knew that there were such things like that. I thought you just do like everything, like you learn about everything. So would you say that like pharmacy technicians are more patient fronting compared to pharmacists? Like, or are you guys also both very patient fronting?
The ATU pharmacy is like more likely like back end pharmacy. But these times like pharmacists will go out and dispense to the patient also. Like most likely like oral drugs, premix like that.
I see. That's so interesting. I think any encouraging words, like let's say if your sister or your brother wants to be a pharmacist or pharmacy tech, what would you say? Like what qualities do you think one should have?
Patience,
A lot of patience.
definitely.
A lot of patience. Anything else? No. Okay, again, thank you so much.
Okay, this is the last interjection, I promise you. I think 3 must be our lucky number because we just had 3 pharmacy professionals also back to back, and they're either a pharmacist or a pharmacy technicians. And you've also probably heard them in the earlier part of this episode. No prizes for guessing in NCC. Pharmacy is the second biggest group. Well, now you know.
So that's the end of the AHP day. It was super exhausting, don't you think so, SP?
Yeah, we managed to interview so many professions, and we hope that you will like it will help to provide insights into what they really do and just to know more about them in general.
That's right. We have covered a lot actually. Interesting AHP's professionals. And we didn't know that we could interview them like that many. So
basically everyone, right? Yeah,
yes,
we managed to interview everyone. That's great.
That's great. Yeah. So we sort of learned a thing or two from their professions when we did the interview. So we are very glad and honored that we had this opportunity to share a bit of the podcast and cover the happenings of this event at AHP Day. And we hope that we'll be able to cover similar events in the future and get to know these professions a little bit more.
Yay! All right. So if you have any burning questions, check out the feedback section on our website. Please feel free to leave feedback, more episode suggestions, or encouragement for the speakers or the host. We would really love to hear from you.
So please rate, review, and subscribe to us. Follow the podcast on Spotify, YouTube, or wherever you get your podcasts.
Thank you for listening.
This has been your dose of content for all things related to integral to radiation therapy.
See you in the next episode.
We're all here together today.
All right.